Hello, everyone, and thank you for joining today's webinar, Being Resilient, That's Live Enterprise, Overcoming Healthcare's Cybersecurity Challenge. This webinar is sponsored by Infosys. Infosys is a global leader in technology services and consulting. Infosys enables clients in 45 countries to create and execute strategies for their digital transformation. From engineering to application development, knowledge management, and business process management, Infosys helps its clients find the right problems to solve and solve them effectively. Infosys' team of more than 198,000 innovators across the globe is differentiated by their imagination, knowledge, and experience across industries and technologies that they bring to every project they undertake. Visit Infosys.com to see how Infosys can help your enterprise thrive in the digital age. I'm Sean Edwards. I'll be introducing today's webinar. Before we start, just a few housekeeping items. If you're having any problems viewing the discussion or encounter any technical difficulties, please use your chat box and send a question directly to me, the host, and we will try to help you. Second, I'd like to explain how we're handling questions. Due to the number of attendees, participant lines are muted. However, if you'd like to submit a question for our presenters, please do so using the Q&A feature at the bottom of the screen. We'll answer all questions that we have time to address during the program. Finally, please feel free to contact our presenters with any additional questions. Please note this webinar is being recorded. You'll receive an email with a link to the video so that you can view it again. Now I'd like to introduce our speakers. Vishal Salvi is the Chief Information Security Officer and Head of the Cybersecurity Practice at Infosys. Mike Wilson is the Senior Vice President and Chief Security Officer at Molina Healthcare. And Venky Ananth, the Senior Vice President, Global Head of Healthcare at Infosys. And now, without further ado, I'd like to hand it over to Venky to get us started.
Thank you, Sean. Appreciate it. Good morning, good afternoon, good evening, wherever you are. My name is Venky Ananth. I run the healthcare business for Infosys. Today, we're going to start off with healthcare context before we dive in deep into the intersection of healthcare and cybersecurity. So if we take a step back and look at what's happening around in the healthcare business or the industry, some of the trends that are listed here are really trends that were there before too, but now have been accelerated due to COVID. And this is really what we think about how things are evolving as we speak. Number one is new care settings. If we recall back in 2018, 2019 timeframe, CVS bought Aetna and introduced the whole idea of a health hub. Then we have Walmart actively driving footfall into the store and also saying that you also have access to healthcare there, and we believe that these trends will further get accelerated where care settings will be delivered at new points of access. Number two, around digital or virtual care, that's something that is dramatically increasing. Just as an evidence, Medicare claims jumped from 10,000 a week in March to about 1 million a week in April. So that's just one data point to show you how dramatically telemedicine or virtual care is exploding. And if you take a Teledoc, which is one of the platforms that's out there, that's again, over 1 month between March and April, they had 100% increase in the number of televisits. And today they have, I think, more than 20,000 visits a day. So that's massively changing, and again, that's an accelerated path because of COVID. Payment models increasingly are becoming relevant again, value-based pricing, wellness, etc. And fourthly, industry consolidation will only accelerate in 2020. It has been on an accelerated path in the past 4-5 years too. If we just look at data between 2016 to 2018, there were more than 8,000 physician practices that closed, and about 14,000 physicians actually moved into hospitals. So that trend is further accelerating, especially given the fact there's a lot of stress in the delivery system and in terms of hospitals and private practices, and that will only accelerate. And new players, of course, with the digitally native, born on the cloud, Oscar Health kind of players are now going to be more and more relevant. So these are really what we think are trends that existed before, but are now really on an accelerated path from an industry trend perspective. And if you think about that, and then move towards digitalization that's really happening around us in healthcare. And if you look at any lens, right, if you take a provider lens, one is, of course, there's a reduced utilization of regular services for obvious reasons. There is increased usage of ER, and there is a lot more of customer service load that's really happening from a provider perspective. From a payer perspective, there's reduced claim volumes because of lower utilization. There is increased focus on community care, again, given the context of COVID that we all know about. And there is a lot more of engagement from a customer or a patient. So that's really what's going on from a payer perspective, and from a consumer for regular patients and consumers. One is there's a lot more focus on wellness. While it used to be a nice thing in the past where people would talk about, now there is increased awareness around wellness. There is higher adoption of digital health tools, and that's clearly happening. And again, evidenced with I just gave you a simple example of the number of Medicare visits that's happening between March and April. So, and we're talking about a very different demography, even embracing digital tools to access healthcare. And of course, lastly, there's an increased utilization of behavioral health services, which has become again paramount in the context of the times we are living in. So given that, our opinion is that one is there's a clear increased utilization of cloud-based platforms. That is really the way to scale, and we think that cloud acceleration will continue. It'll in fact be accelerated. Number two is, again, digital services it's going to be a one-way street. The adoption is already there. There was a change management problem that we had. I think a lot of that mindset we have overcome, and now there's going to be increased adoption of digital. And lastly, this whole internal ecosystem, external ecosystems is going to be a lot more fluid, where a consumer or any stakeholder in the constituency you will not really be able to divide between an internal or external, because the ecosystem is going to come together to start delivering patient-centric care, or even core administrative services, etc., etc. So that's really how digital is going to expand. And in that sense, our view is that from an Infosys perspective, the key or some of the key success factors when you start moving on to this entire digital journey that most of the constituents will move into in the healthcare industry. These are the 4 or 5 things that we think are very critical. One is about personalization and experience. So patient experience, consumer experience, payer experience, provider experience, the entire stakeholders involved in an ecosystem experience is going to become very key. Number 2 is around data and integration. We have spoken enough about data being the new oil, but that's going to be much more paramount. That, along with integration, interoperability, that's going to become more and more critical. We have enough regulations around interoperability. That is not really the focus of this topic, but that's going to be more and more relevant. The third piece is around artificial intelligence, again, gaining traction by the day, more relevant to augment human capability to make things smarter, better. The fourth one is going to be agile and DevOps. And agile particularly it's not just a technology gig, it's also about how businesses can be agile. How can you adopt virtual care in a dynamic way so that you can start, moving along based on the trends that's happening in the industry and in the markets. And lastly, and the focus of today's conversation is really about cybersecurity. When all of this are happening, how do you really look at one of the key success factors on any of this to succeed is really going to be cybersecurity. And it's important to understand how do we view cybersecurity in the context of healthcare delivery. And there are so many moving parts in the ecosystem, and all of them have to come together if we have to deliver on the kind of promises that we are talking about in terms of the industry trends, the promises around digitalization, around experience, about data, about integration, about AI, etc., etc. So that's really what we think are critical. And That's really the context of today's conversation about how do we think about cybersecurity in the context of healthcare. And with that, I want to really call upon Vishal, who is the CISO and really an expert in cybersecurity, and going to walk us through some interesting facts of what has happened through the year from Jan to now, a whole lot of incidents. And Vishal, please, kind of share with us your experience and your opinions on what are the best practices, what are your recommendations on what everybody is doing, what the industry should be doing, and your own personal opinions about this topic. Vishal?
Hey, thank you, Venky. Thank you so much for that introduction. And good morning, good afternoon, good evening to all the folks who have joined today. Thank you so much for joining. It's been almost 100 days now that we're kind of going through this post-COVID situation. And clearly, initial days was about crisis management, extraordinary work in terms of taking, all the office work to home offices. And we know that majority of the organizations today are operating through remote access infrastructure. And while that was happening, there was one more significant event happening in the cybersecurity world, and that was the real increase, extraordinary rise of the malware attacks, the COVID phishing campaigns, and various other things that have been happening. But if you have to take a step back in terms of the history of cybersecurity per se, you'll see that, the industries which were the targets maybe 4 or 5 years back were, the financial industries, the telco industries, and so that was where the cybersecurity action was. But in last 2-3 years, one of the things that has significantly changed is that, there is no discrimination now. I mean, every single industry is under attack, and so has been the case with healthcare. And there is now clearly heightened activities. We're seeing, identity loss. We are seeing IP loss. We are seeing ransomware attacks. And also a couple of days back, European Commission has talked about the political condition and the situation where nation states are, targeting hospitals and institutions. So clearly, what we are seeing is that, what was earlier something which was not experienced by the healthcare industry, it is now a clear and present challenge and a risk that, healthcare industry needs to manage. So if you look at in terms of why that is the case, if you look at in terms of the nature of the business that we are talking about, we are talking about critical life-saving equipment. So any impact or any denial of service to that have a significant impact. And so therefore it becomes a natural target, right? The personal health information is obviously a target for the underground, and it can be easily monetized. If you look at in terms of the systems and the technology which is being used in the industry, it is heterogeneous, and therefore it's become that much harder to deliver and manage cybersecurity for these systems. We are seeing a rise of telemedicine, but also there has been a significant amount of IoT devices, which are typically, again, very hard to secure, which is used in this industry. And last but not the least, given the fact that now we are under COVID-19 situation, and there's so much of research which is happening, it is a natural target for the threat actors to look at going and accessing that IP. So if you look at in terms of the risk which are there, obviously all of these vulnerabilities give rise to the risk to the industry, and just at Infosys alone, overall we have counted around 150 plus ransomware attacks across different companies in the world, and that is something which we have been counting, and there could be many more which have got impacted because of ransomware. Telemedicine is clearly again a new area where with digitization and with connectivity, there are obviously vulnerabilities that can be exploited, including people exploiting home routers and exploiting them for their own nefarious reasons. Similarly, insider threat, getting access to sensitive data. We obviously look at, if you look at healthcare, it's a complex system of multiplayer ecosystem. And so, the whole chain and the value chain needs to be protected. But at the same time, because of that, the attack surface grows, and that becomes a high risk area. And last but not the least, the healthcare apps and the legacy of the apps have, major issues in terms of being end of life, patching and vulnerabilities which are there, which need to be, remediated. So all of these are contributing towards the risk to the healthcare system. Now, what could be the strategy that one can adopt when you look at addressing this problem? And clearly, when you look at cybersecurity, most of the solutions that we talk about are universal in nature, but there are clearly nuances in terms of how one could go about when you look at healthcare industry, right? One is about, building sound security standards for every equipment that you have, building right policies for hardening the solutions, building, protecting the devices, protecting your legacy applications, and creating almost like a zero tolerance based approach towards your IT hygiene. I think time has come when the reality of today's running a business is that it will come in contact with the threat, and you have to assume that and then build your solution and hardening to deliver and ensure that there is enough amount of protection in managing these attacks and these contacts. The next is about building a zero trust model, and everybody talks about zero trust, but what really it means is that building network segmentation, controlling your access, having 100% multi-factor authentication, securing your remote gateways, making sure that you don't have split tunneling, protecting your personal devices and personal routers, creating awareness, various things which are required, because clearly the perimeter also has shifted to home offices. So you need to make sure that that extension does not introduce insecurity, and you build models which are resilient in these times where remote working is prevalent. Third is about looking at the data and looking at which are your crowning jewels, what should be the approach related to encryption, masking, and basically making sure that data at rest as well as data in transit is protected, ensuring that there is proper access reviews, access control, and then information leakage monitoring. So you need to have a data-centric approach towards how you're protecting your information, especially because the perimeter is missing. And so you need to make sure that your protection travels as the data travels across internet. So secure by design, we've been talking about this for many years in cybersecurity, but it is so very fundamental even now, making sure that you have the whole ecosystem, understanding the need for secure by design, embedding security at the very early life cycle of your projects, making sure that every single individual within your organization is aware of the roles and responsibilities, making sure that they are empowered with necessary technology, necessary knowledge, which is required for them to do the right things, making sure roles and responsibilities are clearly defined so that there are no diffuse accountabilities and diffuse responsibilities, and then building a culture of security on an ongoing basis so that people are incentivized for good behavior and are reprimanded when there is a bad behavior. So we breed, and that way we breed a culture of security and drive towards the concept that you embed security when systems are getting built. The fifth and important aspect of this is about the ecosystem. Now, if you look at the healthcare industry, it depends on multiple partners and stakeholders in the value chain. And every single partner, every single vendor has a very important role to play in making sure there is an assurance to the way information is protected and integrity of the information is managed. So therefore, you need to have a governance and a compliance process by which you are able to identify your different partners, make sure there is a proper risk-based classification of these partners, and then you adopt a strategy where you are able to enforce the security controls as you would want to do within your organization. How do you extend that to your whole value chain so that you have an end-to-end assurance of protection and security of that information? And last but not the least, when you have built all of this, given the fact that we are having multiple types of threats and attacks which are happening, there is a need to invest in building a process of having a real-time monitoring and response to how you are detecting these incidents. So visibility, quick visibility of activities happening on your system, on your network, and then quick response in terms of how you're going to manage, remediate, contain, and recover from that incident. And for that, you need a significant amount of investment in understanding the anomalous behaviors, having automated playbooks, using modern technologies of AI and automation to make sure that you are able to automate all of these tasks and focus on the cognitive efforts goes more on building policies and the use cases, but the actual mundane work is actually done by the technology and automation. And then you are able to quickly respond and recover from that. So I think that is very, very critical. Now, all these 6 elements that I talked about, of building great standards to zero trust models to data-centric approach, building secure by design, compliance and governance for your partners and vendors, and manage detection and response will give you that assurance and comfort that you are driving cybersecurity as a strategic initiative, and therefore you're converting that risk into an opportunity by being able to differentiate your business and remain protected, and therefore assure your customers that your data is safe and secure and your patient data is safe and secure. So with that, I would like to introduce Mike Wilson, and I thank Mike for joining us today, and I'll now hand it over to Mike to cover his topic.
Thanks, Vishal. Can you hear me okay?
Yes, Mike.
Great. So for those that don't know me, I'm the Chief Security Officer and Chief Information Security Officer for a company called Molina Healthcare. Molina Healthcare is what's called a managed care organization, and we provide services to approximately 4 million lives or members on behalf of state governments. And a moving target, but we're moving from 15 states to approximately 18 states, having acquired some companies recently. Roughly a 20 billion company, and in revenue, and 150, 60-ish on the Fortune 200. So pretty decent size and scale. Definitely an organization that takes its core values around healthcare and providing healthcare to government health plans such as Medicaid and Medicare in the US context very seriously. So Vishal asked me to join this call and maybe just offer up a few sentiments around healthcare and the context of obviously a security officer in a healthcare organization. And when I listened to Venky and I listened to Vishal, I think perhaps my goal today is perhaps blending the two themes, right? So we've heard from Venky the candidly a number of themes, particularly digital themes in healthcare, and they are very real. And at least in the Molina context, I would vouch for just about all of them. And Vishal took us through, just an exemplary good playbook, candidly, how you did it in 6-7 slides. It makes my job look easy in terms of, the things that we should be going after from a cybersecurity standpoint. And I think my goal here is to blend the two. And in doing that, I think it would be remiss not to put a point of view out there, particularly a point of view related to, in my view, an acceleration of a theme that's been happening for a while now around digital protection. And the fact that COVID-19, in my view at least, is accelerating digital healthcare, and by default, I believe accelerating our role and the change of our role as chief security officers and as cybersecurity professionals from one of a traditional archetype to a new archetype, which I would put out there as more aligned with digital protection. Okay, so that's my point of view. As we think about what I'd like to sort of bring forward, really 3 points to sort of underscore this. So the first I'm going to touch on is a brief discussion around the changing role and why I think this is happening right now and has been leading up to this for a while, and will continue for the next couple of years or so. I'm going to explore a little bit, probably focusing a little bit on Venky's discussion around digital, but thinking about it a little differently in terms of digital protection and what are the drivers to change. So we'll touch on that a little bit. And candidly, the opportunity I think that presents to us. And thirdly, and perhaps just the capstone, some brief comments about the Molina story and how we've approached topics like zero trust and so forth, and where we are in that journey, and just a few examples. Obviously, that could be quite an involved discussion in itself. So first off, I make the point that I believe the CISO role is changing, okay? And I've had this view for a while, but those that have heard me speak in other forums would have heard this point of view before. The point of view that largely stems from some work that Korn Ferry did probably 3-4 years ago now, where they looked at the security officer role and they made the point, okay, it seems to fit into 3 archetypes. If you bear with me, those 3 archetypes are such. The security officer might have come from a 3-letter acronym agency. And admittedly, this is very US centric, but I'd say this is probably fairly similar around the world as well. So, law enforcement and so forth. That's particularly relevant for chief security officer roles, clearly, with physical security as part of that mandate and business protection and so forth. But arguably is very, very similar for CISOs, and we see that a lot in heavily regulated industries. Individuals in that archetype don't necessarily have strong technical skills, but they have a very good understanding of the threats. They have a very good understanding of the threat actor and the tradecraft. The other archetype is more in the engineering sense. So think engineer come executive. Okay, so very technical background. This is an interesting role in some respects. Very common, probably 2/3 of the roles out there are still this archetype. Tends to be traditionally a little bit of a backroom role. Think of computer scientist, engineer, come executive and leader. Heavily seen in tech companies, for instance, and technology organizations. And I'm in the Bay Area here, so you can appreciate I have a good visibility into individuals that fit in that archetype. The third archetype is equally common, probably not as common as the other 2. I would argue Vishal, if I was to be arrogant, would probably fit perhaps aspects of this. I probably fit aspects of this, which is more of a strategic mindset, strategic risk management. So comes probably from a consulting background, perhaps, thinks more strategically about the risks associated with security, may or may not be technical, but that's another archetype that you see out there. Again, tends towards regulated organizations. I would make a case, and I'll underscore it with the view around digital in a moment here. I would make the case that there's a new and evolving role that any of those archetypes, all still very relevant, need to start to think about from a skill set standpoint that, and particularly in all industries, but particularly healthcare, again, COVID-19 is a backdrop, and I'll get to that point in a second, which is product management, disciplines around features and functions within software, disciplines around thinking about security and the concept of how you think about bringing a product to market. And we'll talk more about that in a moment. Business risk leadership. Doesn't matter what archetype you think you're in, the reality is, and this is my second point, and probably more hitting on the digital transformation that's going on in healthcare and other industries, this has become a board issue. It was a board issue because of risk and security and concerns around exploits and large-scale issues such as Anthem and others that we can render off since 2015 around, you know, the big hack. That's still out there, but it's become nuanced. And the nuance is because of digital, because we're relying on technology now for our business. Take telemedicine as an example in the COVID situation. Vast majority of healthcare at the moment, although somewhat changing as we head back to the office, it's still very much germane to being done over digital formats. Teledoc, and so forth. Working from home in the COVID-19 context, we're all reliant on technology now. We have been in the past, and now in a very visceral way. We can't work very effectively if Zoom's not up and running. Within the healthcare setting, the managed care setting in particular, it has become all about data. Venky was absolutely correct in that regard. If it's not talking about experience of the member and digitalization in terms of form factors around mobility and moving e-commerce platforms into approaches that are more digitally sort of conversant with our members and our customers, then it's about analyzing the data. So if you think about the vast amount of data, so Molina collects 1.5 billion records a year, roughly, around 4 million people. So that's all their encounters. So that's in a drug setting. That's you know, in the hospital, the inpatient, outpatient setting. That's in relation to claims data. It's in relation to all sorts of data points. And that data tells a story, and that story is starting to become very relevant in terms of outcomes for our patient in terms of their well-being, and also in terms of, candidly, our survival as a health plan to be able to scale, be more efficient than the other guy. And so the reliance now on data and analytics, hard to have a conversation in the business context at the moment where there isn't a data component to it, and some sort of advanced analytics, descriptive or predictive, take your pick, but definitely very much the focus and trend. And so this is underscoring a business need now around, okay, we need to rely on this data, we need to rely on telemedicine, we need to rely on work from home, we need to rely on medical devices, which I haven't touched on, I'll touch on a little bit, in a way that arguably is different than the way we relied on it in the past, where perhaps it was a little bit more analog come digital, but now it's full digital, okay? So think about the autonomous vehicle to really underscore my statement, a little bit out of healthcare. Would each of us, any of us, get into an autonomous vehicle? And probably answer my question of saying yes, and we're hopping in Teslas and so forth. But in the future, will we hop into a car and it's going to drive itself? And it might even fly. Now I'm getting a bit weird. But, you know, arguably, would you hop into a flying drone that's going to drive itself? And are you going to do that within the next 5 years? I don't know. What will allow you to do that? An absolute trust in the technology. Absolute trust. Likewise in healthcare. Would you implant a device next to your heart to keep you moving? If you have to, you would. You're going to trust it. You're going to hope it's solid. You're going to trust it probably until you can't trust it, which means if it ever got hacked. And that's more the medical device perspective. And so all of these issues speak to a business dynamic that is far different than what we've done in the past, supporting a CIO in the back room in terms of making sure that the billing system's up. or worried about whether, don't get me wrong, privacy is very important. But candidly, it's not the only topic. And so worrying about patient data getting out there and it getting ripped off and all the rest of it, yes, that's important. There are financial implications, there are contractual implications, compliance implications. It can cause havoc to have a large breach. But the world we're heading to, where we're relying on digital and the intersection of software and hardware in a way that reflects trust, in a way that basically could be business model changing. Think of, right at the moment under COVID-19, the Safeways of this world, the Krogers of this world, competing with Amazon in terms of grocery. If their e-commerce platform is not up to the minute, there's a lot of portability of where I can buy my milk. I can go to a Whole Foods, I can go to a Albertsons Safeway, I could go to, take your pick. Which digital platform's up at the moment? I don't really care if it's down, I'll go to the next guy. And so these are very meaningful, and I might not go back. I might like Whole Foods experience, not go back again, and that's the end of Safeway's experience. So I guess the point I'm trying to make is these business issues have become very real, digitally related, and I would make the argument that COVID-19 is the thing that's pushing us there quicker in healthcare, but probably in a few other industries, but particularly in healthcare. And the advent of telemedicine is your classic example. We're even seeing regulations in healthcare allow the movement towards telemedicine. There are now exemptions, again temporary, but exemptions for some issues under privacy and privacy litigation and so forth, and fines, as it relates to, coming from CMS, Centers for Medicare and Medicaid Services, as it relates to point of care and the use of form factors for telemedicine. So if something goes astray, there's a little bit of leniency in the context of COVID-19. So there's a relaxation. I wouldn't say it's wholesale. Unfortunately, Molina still has a duty of care, doesn't quite extend to the point of care situation for an insurance company. So there are still concerns, but the drive is towards embracing this new technology. So that's become an accelerated board topic, an accelerated management topic. I would argue business leaders, CISOs that are not embracing that they are digital protection specialists, that need to think about talking in terms of business, in terms of why is this relevant, in terms of topics of trust, and topics of how our support of initiatives, features and functions in the solutions that are being delivered to our customers, which is a product management discipline, all of these things I would argue are new to us on the whole, and present an opportunity for us to rethink how we show up as security professionals. I'll touch briefly on the role of third parties. As we think about our roles, I think we need to also be humble. It's a big shift, and there's a lot of change going on with regards to this digital transformation. Reliance and support with partners is going to be paramount, in my view. Skill set shortages abound, particularly in the cyber area. So we'll touch on this a little bit in a moment when I talk about the Molina story, but part of our challenge, I think, is as we evolve our functions to be more digitally protection orientated, we also need to come back and say, well, some of our traditional things that we've done, do we need to put so much emphasis on them as security professionals? So I'll give you an example. The IT of doing security, antivirus software. The IT of doing security, building a SOC. The IT of doing security, pick your security solution. So I guess the solutioning engineering. And it's very subtle. I think our role as it unfolds is still to be security professionals and provide guidance. Definitely we have a role in talking about architectures and talking about design. I think we need to spend more time thinking about threats and threat modeling. We need to understand and be able to talk about this in the context of what is the business risk in a way that's clearly understood by our colleagues across the various business functions. But I'm not sure we need to do IT for security things. And I think there are a lot of partners that can help with that. And, I've made a few bets in that regard, and I'll continue to make them. I think with the scarce resources around the security and cybersecurity area, and trying to dial in these new skill sets we need around product management, security, arguably more software-related, cloud-related skill sets, which are hard to find, to have them get tied up in building the machinery for IT security, which is an IT engineering exercise, and not executing the security strategy, which is looking at the security topic in terms of threats and understanding the outputs from the tools, I think is a danger. And I think partners can really help on that. The other area of partners in healthcare is partners are my weakest link. And what I mean by that is the ecosystem in healthcare is probably more porous than most industries that you could come across. We're all reliant on everybody else. By default, Molina Healthcare has 150,000 providers that provide services to what we call the network, to our 4 million or so members. By default, I need to share data with them. By default, I need to allow access to our systems. By default, we've set up these very elaborate exchanges in healthcare to be able to exchange data because it's complicated and it's become very clunky as we all digitize our health records to be able to move data around. And so these organizations and constructs help, but there is absolutely there's no getting away from the fact that the ecosystem of healthcare is its own weakest link. A smaller provider can cost me a lot of money. A smaller provider can let my member down. A smaller provider can also hold their head up high and actually do a really good job, but it's a scale issue in terms of our ability to support the healthcare ecosystem and third parties. The vast majority of healthcare is 50% small business, maybe medium at best. The scale that you get through health systems and the like is helpful. The scale you get through companies like Molina and others are helpful. But at the end of the day, when you get down to the assisted living organization, when you get down to the home care organization, it's fairly small business, which is great in one respect, but challenging from a security standpoint. So I see that as a challenge for us as we go forward, both a good guy and a bad guy in terms of how we rely on third parties, one for delivery of IT and security services to help us and skill set shortage, but also our reliance on third parties as we think about the ecosystem of our companies in healthcare. Touch very briefly, because I'm conscious we should allow some time here for questions and so forth. But the digital sort of protection drivers, as I see it, you've heard a lot of this from Venky earlier on, just to underscore it. It presents an opportunity for us to rethink security and build that in, okay? So all this digitization's going on, it means that IT is basically rethinking its stack. That presents an opportunity for us to put the security stack back in. And that's a good thing, but it's happening a lot and it's happening fast. And as I said, my thesis is COVID-19 is accelerating it. So if we think about IoT and medical devices, we've got a problem. It's a challenging space. If you think about a Kaiser, for instance, right? I think they're fairly public in suggesting that they have around 400,000 medical devices in their group of hospitals and so forth. You know, they don't have 400,000 servers, right? So it's taken us a long time to solve the security problem, arguably, with a lot of the points that Vishal related around foundational security, patching systems, and so forth. And part of that is to know what systems you have. So asset management and inventory. So if asset management and inventory in an IT context is about knowing what server and what operating systems running on it, maybe some of the application components and so forth. Think about that in the concept of medical devices, okay? So you got a drug pump, but you don't just have one, you have 8 of them and different brands. And so several thousand perhaps rolling out in a health system. And so how do you find them? They're portable, they move around. They're on this floor, that floor, right? They're IP driven, so you can generally identify them eventually. Then you have to identify them, you have to identify what firmware they're running, what sort of operating system they're running. And then many of these devices don't allow you to interact with them like you do a server. So how the hell do you protect them? And not only are you trying to protect something that's fairly deterministic, like something that you plug into your arm, to be quite literal and crass about it, a medical device that's basically a piece of hardware with software in it, right? In some cases quite sophisticated, in other cases dumb. How do you protect that in an environment where you're surfing the internet, and your employees doing email? So you have a deterministic, fairly predictable device that communicates, MRI system, that communicates with maybe a digital PAC system on the back end, which is an imaging environment, in a fairly predictable way. But it's sitting in an undeterministic, chaotic in some cases, network. Traditionally, we've done it through segmentation, to Vishal's earlier point. Hard, right? Layer 3 type controls, networking, all the rest of it. We've used now new solutions coming out from companies like Forescout and all the rest of it to sort of think about it in terms of maybe we can group these medical devices in ways that we can sort of cope with. There are new companies coming out, Orders one, Aramis is another. There's a number of different companies that are coming out with trying to solve the inventory problem in medical devices. Where are those devices? Trying to locate them and then to wrap them, if you will, a little bit like a NAC control, a NAG control, to actually wrap the security around these devices so that we can track them, we can protect them, almost like the virtual patch within an unpatched environment and network. Really big problems though, right? And that's just one area. I haven't gone to telemedicine. I haven't gone to the fact that we're all moving our data centers to the cloud. And I haven't really touched greatly on the challenges we have around advanced analytics and data and getting down into the data, not just encrypt the data, but people want to use the data. So you can't just encrypt it. You've got to do it in a way that has some fidelity to it. And we're moving to personalized medicine, genomics. Okay, how do you de-identify DNA? Believe it or not, there are techniques out there, and that's the role of us with our privacy colleagues to start to understand those techniques in healthcare. I don't have time with those sorts of activities and challenges to go back and work out how to patch a server. That's an IT problem, right? But unfortunately, I need to make sure that happens as well. So it's a challenging space we're in. So anyway, the case study and how we're thinking Molina, and I'll just do a couple of points, just give you a flavor, and then I'll stop because I think we need to be providing some time here for some questions. So kind of three things that we've been doing. We are getting a lot of support from partners on this, so this is not all a wholly Molina story, but the first thing we did is we looked at governance, right? So as we think about this digital transformation, I think we made an acknowledgement fairly quickly that as a regulated entity, we probably need to follow a model that's probably more germane to financial services. And so as we think about that, this idea of second line of defense and first line of defense. So that's what we did. So we pulled the IT for security activities out, the solutioning engineering, and we put those very deliberately into a function within the IT organization. And then we created another function, which is very much about, governance, discussing the business issues, design, architecture, threat modeling, and so forth. And that's actually sitting in compliance and legal, where I sit. And so second line of defense, first line of defense. Third line of defense, pick your auditor, right? But I mean, you get the idea. And so that was sort of our attempt of raising the profile of the conversation to be more business centric. At the same time, creating a little bit of tension with the IT colleagues, but also allowing IT to start to own converged technologies, including the security aspects of that. So as we move to the cloud. So that's a very involved conversation we could sit here for an hour and chat about, but I won't. Digital protection modernization. If it has a security tag to it, coming back to the digital drivers, as we modernize all our applications, as we modernize for our digital transformation to the cloud, as we start doing new solutions with third parties and analytics, we're building our security pieces all over it. So some of the areas we're doing, and they touch on zero trust, the always on VPN concept, global protect, Palo Alto type concepts, embraced. Identity in the cloud, tying that identity to a device, so you know who you are and where you are, and you're always inspecting. And then to Vishal's earlier point, segmentation, and segmentation on steroids. We're on our second attempt now. First attempt, we had to back out. We're going to Microsoft Azure. using native controls, network security groups, and so forth, as many on the call will be familiar with. Backed it out, too hard. Mainly because not Microsoft's fault. Candidly, our developers don't know what talks to what. It's just a reality. When you get down to a host level, and all of a sudden developers have to start thinking about hosts as software and parts of the software stack, it's, you can't assume they know. It's not fair. So we spent some time, we had some products like Tektration and Illumio and so forth from Tektration's from Cisco, and basically analyze flows between applications. And then we've been putting rules automatically into a dynamic nature into Azure in a way that you could never ever do, easily at least, maybe with VMware, but generally not in a data center, and build that segmentation, which to Vishal's point is key. Then extending that idea in terms of how we think about segmenting compute in our SaaS platforms and our other PaaS platforms. Think Salesforce, think Oracle, think wherever, right? And that's kind of our zero trust story as well. Rethink endpoint, rethink monitoring, put that in the cloud, so we're looking at the Exabeams, the Splunks and so forth, Microsoft's Sentinel product. So you have to rethink everything, which is fair, great opportunity for us as security professionals, but it's all happening at once too. And I would argue that COVID-19, all of our initiatives in security modernization have been brought forward 6 months, easy. Endpoint redone, monitoring redone, all in response to the fact that we've got employees now that are largely working from home. That's my story. I'm sticking to it, Vishal. So thanks for listening.
Great. So we've got a number of questions coming in. First one for you, Mike. With clinics switching to online consultations, especially with private operators, what are the must-have security controls that need to be considered?
Yeah. Sort of depends what clinics we're talking about. I think it depends on scale and size. I think for just sort of covering the basics, I think Vishal covered that very well earlier in terms of probably the first area is endpoint. Next thing is where's your data going and how you're protecting it. Yeah, it's a hard one though, because as I said earlier, most of the clinics are fairly small. They're lucky if they've got an IT individual in there, right? So again, and perhaps for the large majority of smaller to mid-size organizations, which makes up half of healthcare in this country, I would recommend they go to a partner and find somebody who's got some security skills to help them out, to be blunt.
Okay, that's a good comment. Vishal, another question coming in for you. What are some of the additional controls healthcare organizations should consider apart from the core remote working parameters, especially for vendors and partners?
I think, cybersecurity is all about, having a very comprehensive approach towards, implementing the different controls, right? Because you're as good as your weakest link. So when we look at, as a CISO driving a strategy, you would want to look at, an approach which covers every aspect, right? From your governance, your policy, in terms of how you are engaging with your leadership, your board, and your peers and across your organization. But then, looking at your security architecture, looking at your fundamental controls, but then also looking at what your risk landscape is and building a strategy where you are trying to always stay ahead of the curve in terms of investing forward-looking controls. So, for example, at Infosys, when we look at our cybersecurity strategy, we are timing the market such that we are at least 9 months to a year ahead of where the market is. And that strategy helps you to innovate and stay constantly ahead of what the threats are, right? So I think it's all about building a very comprehensive approach, and within that, the areas that I talked about in terms of moving from a static monitoring control to looking more at managed threat detection and response is very important aspect. Looking at the data and putting controls around your data is extremely important. but also, in today's context, getting the fundamental foundational security right is also so very, very important. The devices, the operating systems, the cloud infrastructure. In fact, cloud provides an excellent opportunity to get it right first time. In fact, the security industry, the security product industry has applied all lessons learned that we have gone through and applied, and they are getting the security right. They're simplifying the architecture. It's much more easier to explain and much more easier to implement. And so clearly, I think, embedding, security into everything that we do is extremely important. But I would say all of these together really make a foundation for a sound security program within a given organization. Sean?
Mike, another question for you. How are you managing certificates and digital identities as you go through things like M&A, you push digital health, adopting cloud and DevOps and IoT?
How do we protect digital certificates and so forth? I mean, I think you could take that a number of different ways. I think from a device standpoint, it could take it that way. I think I'll take it in terms of responding to API management. So we're using a product called Apogee, which is a API gateway. And as we think about monolithic applications heading more and more towards applications that are more microservices based, or even sort of monolithic applications, platforms and so forth. In healthcare, for instance, you have applications like Pega. It's a fairly well-known system, not only in healthcare, many systems. Pega is really a platform, and you buy modules on it for some of the business processes in healthcare. And I'll give you an example, like appeals and grievances, somebody calling up and having an issue. So that ecosystem now hooks into APIs, and APIs, hook into just a palaver of third parties, and both into and outside the network. Again, coming back to this concept of reliance on third parties and health ecosystem. Presents a really interesting digital problem, and I think certificates are part of that, as are protocols, OAuth or whatever you're following. But how we embrace security and authentication and concepts, which in some cases can be quite unique depending on the applications we're speaking to at that API layer. I see that as where this is trending a lot more than the user certificate device piece, which I think largely we've solved for. I think that's the piece that I think there's a lot more analytics, business analytics to be done, and is candidly a harder space to sort of get into and manage. I'm not sure that answers your question, but it's my response.
There is a follow-up for all three of you, and it really gets down to, what about managing your PKI, public key infrastructure, and moving that to the cloud or managed service to protect your internal certifications with a true root trust? Any of you can take it. It's really for all three of you. I think a quick perspective would be helpful.
Mike, you want to go first?
Yeah, I mean, I think the premise here is that as we rely more and more on secondary tokens and certificates and so forth, and APIs or devices or whatever, then this root of trust idea about, well, is it unilateral, is it bilateral? So if you think about trusted third parties historically, and this is dating me a little bit, but like Be Trusted and some of these other concepts, again, out of industry than necessarily healthcare, they were put out to create sort of bilateral trust. What's the modern equivalent of that now as we think about sort of identity management, as we think about use of certificates and moving PKI necessarily, or just the fabric of authentication and sort of the idea of sort of, I guess, Google's beyond trust idea, or beyond corp idea, as we sort of go zero trust and everything. I think that's where this theme of your question's coming from. Yeah, I mean, it's challenging. It really comes down to fit for purpose. I mean, if you are managing to your population, then you'll probably have more unilateral trust, and you'll manage your, trust, your root of trust, or whatever your crown jewel identifier is, and how you manage that, right? PKI or otherwise. If it's more you're in a partnership, then it gets a little bit more challenging. And there are protocols, SAML and all the rest of it, which we all use for single sign-on. There's protocols about how we interoperate. As we think about exchanges and their role in terms of doing, in healthcare, for instance, how we match records together, and it becomes more of an identity problem of, you know, statistically, have you got the right match? You know, so there's a lot of permutations to what you're saying beyond, in quotes, PKI and cert. So I probably broadened it a little bit, but kind of depends, is I guess what I'm saying, on the business context and what you're trying to do.
Okay, we have time for one last question. So there are a number of questions that we didn't get to, so there'll be an option for you to ask after the fact. We'll send something out in the follow-up. This one's for Vishal and Venky, and I think it's a good one to end with, which is, how do you reconcile the focus on digital versus the continued need to protect data and information?
So maybe Venky, I'll go first, and then you can maybe add in, right? So I think I think they are complementary to each other, because and the reason I say that, we did a very comprehensive survey with all the technology leadership around 18 months back, we called Digital Radar, and the questions were, what are the key priorities for you, for your organization in digital transformation? And what was interesting is that the question that and the topic that got maximum votes was cybersecurity. And the way we read this was that cybersecurity is a foundation for your digital journey. Now, when I was the CISO for a large bank, we could easily see that with security, we were powering the bank to do business with confidence and to reach out to those whom we would otherwise be very careful without security. So security becomes a very important foundation element for your digital transformation, right? So I guess there is no kind of, they mutually exist with each other. And with cyber becoming mainstream, it is actually going to be a strategic advantage for those organizations which are adopting cyber as a core component for their digital transformation.
Yeah, and Vishal, I would agree, and frankly, I kind of covered that when I spoke about digitalization. I mean, really, we think about 5 success factors, and so experience. We talk about data and integration, AI, agile, and the 5th, piece is really cybersecurity. So when you bring them all together, that becomes the core of any digital program or transformation program to be successful. That's really how to think about it. So they're not independent of each other, but they all have to come together. That's really what our opinion is. Thank you.
Okay, we are out of time. I want to say thank you to Vishal, Mike, and Venky for taking the time to speak today. Thank you for Infosys for making today's session possible. If you had a question that was not answered, there will be an option for you to pose that question to the Infosys team, so be on the lookout for the email recap. Just a reminder, the webinar has been recorded. You'll receive an email with a link to the video so you can view it again. To access any additional webinars and get information on how your organization can speaker sponsor, please visit wcwebed.com. Thanks again to all of you for joining us today. Have a great day. This now concludes today's discussion.